So we're gonna do what we can. We're gonna start with the back muscles. Of course, it is a lot, and it's like really confusing, just because it's a lot. But when you start to study the muscles of the body, when you start to get to know them, you see that the way that kinesiology or anatomy organizes them makes a lot of sense. They're basically organized by broadly speaking, like where they attach. So first there's the extrinsic superficial back muscles, right? And then there's the intrinsic superficial back muscles. So let me just read what the muscles are also called immigrant muscles because they actually represent muscles of the upper limb. So the upper limb is the arm, right? So these are muscles that attach somewhere to the scapula and or the humerus, and they have during infancy, during embryology or the embryological stage, they start around the upper limb, the periphery of the body, the upper limb, and then the word is migrate. The fibers migrate, or the cells migrate toward the spine. So they start on the outside and they migrate toward the spine. They're also therefore called the immigrant muscles, but just remember that they are the like outside, the extrinsic back muscles. Then there's the intrinsic back muscles, and those are the ones that attach directly on the spine. They begin and end on the spine, and they are responsible for the movements of the vertebral column. They also have attachments. The intrinsic muscles also have attachments to the ribs, which are called the costal area, or the costa are the ribs. And then they have attachments to the pelvis, like the ischium down here, to the sacrum, and they have attachments to the base of the skull. So those muscles are not strictly attached to the spine. They're attached both to the spine as well as the structures above, below the spine. So first, let's look at the study points. And if you could mute yourself, please. So first is to understand the location of the major muscles of the body. Now, what is a major muscle of the body? I mean, I don't know even how to define that. I just know that there's some muscles that I see frequently on test preparation sites, and there are some muscles that I never see, ever. Like there's the deepest layer, you'll see later, the deepest layer of the back muscles. You never see them, like the interspinalis and the intertransversarii muscles. I've never seen anybody ask about those. Never. And sometimes they ask about the semispinalis multifidus and rotatories, but they don't ask about those as frequently as they do the erector spinae muscles and the splenius muscles. I think to an extent, the FSMTB wants you to be successful. And they're almost, and these deep ones, the semispinalis multifidus and rotatories, they're almost never referred to as the transversospinal or transversospinalis muscles. So, and we've only covered so far the superficial layer of these intrinsic muscles. Remember, extrinsic and then intrinsic. Extrinsic starts on the upper limb and then migrates towards the fibers and cells migrate toward the spine. Intrinsic are all on the spine. So these intrinsic muscles, we've only covered the superficial layer. That's the splenius muscles and the erector spinae, the ILS, the SEG or spinal erector group. We've only covered these. We haven't talked about the deep layer or the deepest layer. Control. All right, so we have to understand the location of the major muscles of the body. My advice to you is if you, in trying to figure out like which muscles to study, I would say that there are two things. First, if it's a muscle that you think is part of the common vernacular, like everybody, you know, if you have chest day, back day, leg day, stuff like that. Some of us have arm day or used to have arm day. Hey, I still got it. Anyway, they're like part of the common vernacular and everybody knows where the gluteus maximus is and where the pecs are, then you should definitely know those muscles, right? And then that's the first method. Like if it's something that everyone is part of the common vernacular, like even for people who are not into anatomy and physiology, maybe they work out or maybe even they don't, but they know where the pecs are, they know where the abs are. All right, and the second way you can discern is by the size, right? So there are muscles, for example, in the hand that we're not going to go over, and there are muscles in the wrist. Like we're not going to cover any of these muscles at all. And I've never seen a test prep question about the muscles in the hand or the foot. They may ask about the thenar eminence. This is an area, and the hypothenar eminence, hypothenar, thenar, and palmar. They may ask about that, but they're not asking about the abductor pollicis, whatever muscle. They don't ask about that. And in the foot, likewise, there's lots of small muscles, lumbrical muscles and abductors and flexors. And I don't see questions about those. I do see questions about flexors, extensors, abductors that are in the lower leg. So they might ask about like the flexor hallucis longus muscle that's right behind the tibia bone and in front of the soleus muscle. It's between the tibia and the soleus, I think. So they might, and kind of on the inside, they might ask about that, but they're not going to ask you to differentiate between the smallest muscles in the hand, right? They're not going to ask you to name like the names of all four muscles that go from the corner of the mouth, from the sphincter muscle up to the maxilla. They're not going to ask you all four of those, what I call the smile muscles. The smaller the muscle and the more of them, the less likely they're going to ask you. There's three muscles at the base of the skull. Those are just called, I just call them the deltoid muscle. There's probably the internal, the external, the intermediate, something like that. I've never seen a test question ask you about those ever. Likewise, I don't think that they're going to ask you to differentiate between the deepest muscles of the spine that we just looked at, the deepest layers. But they may if there's muscles that are like, there's three muscles and one of them is pretty big, like the glute min is actually not a small muscle, right? It's like the size of the palm of your hand, and it's one of the only muscles that does abduction. I think you should know that muscle for sure. So if there's like a group of three muscles, like for the glutes or for the deltoids, I think you should know those, right? And for the delts, it's pretty simple. It's just anterior, lateral, and then posterior. And the locations are actually the names of the actions, the names of the location and the action. If there's, four muscles, like the SIT muscles, the supraspinatus, infraspinatus, teres minor, and subscapularis, you definitely should know those, right? I don't think that you need to know for the adductors. I think you need to know all the names and be familiar with them, but I don't think that you need to be able to differentiate between the adductor magnus, adductor brevis, adductor longus. I think just knowing that there are 3 or 4 adductor muscles, and then in addition to that, there's, I think, 2 other muscles that function as adductors, like the pectineus is one. So, if they give you the pectineus as an option among other muscles, you definitely need to be familiar with that. You definitely need to know that. And then I believe the gracilis functions as an adductor, and part of the semis, like the semimembranosus, semitendinosus, those also function as part of the adductors. And then, four muscles in the hamstrings, you should know all 4 of those. And then we get to the lower leg and the forearm. Lower leg is different from the forearm. For the lower leg, you should know almost all the muscles, but I don't think that you need to differentiate between like the peroneus longus, peroneus intermedius, and the peroneus tertius, or no, peroneus longus, peroneus brevis, peroneus tertius. I don't think you need to know the difference between all of those. You need to know that the peroneals are located on the side of the leg. Remember, just like when we're practicing concentric, eccentric, antagonist, and agonist, when we're identifying those, we first start with the question: what surface of the body are the fibers shortening on? The fibers are shortening in the front. Which muscles are in the front, right? And if you start that way, like what muscles are in the common vernacular that you've heard of already, and then is the muscle group that I'm looking at, are they like really small muscles, right? Are they really small, or are they like larger muscles? You don't need to know. You need to know that there are intercostal muscles. You need to know that there's a subclavian muscle, but you don't need to know like the muscles of the face, the small muscles behind the ear, the muscles of the eye. There are so many muscles in the body. There are circumstances where you want to know each and every one of those, but those are special, not for the MBLEx. Okay, and then the second one is to demonstrate the ability to locate the attachment sites of the major muscles of the body. Again, they're saying major muscles. Well, which ones are major? And attachment sites. All right, attachment sites. Well, some of the questions that they're going to ask you are going to be phrased in such a way that they're a little bit difficult, like the coracoid process of the scapula serves as an attachment site for which muscles? That's a pretty difficult question. That's much more difficult for you to name and eliminate or differentiate between all the choices there about one bone, and it's friggin' small bone too. So that's like they're not asking you that in the spirit of helping you. Let's put it that way. However, there may be some clinical value in that. But if you know, for example, that that the pectoralis minor attaches there, and if you know that the name coracobrachialis, that the name coracobrachialis means coracoid on one end, an attachment at the coracoid and an attachment at the brachia bone. I don't know why it's called that. It's the humerus, the brachia. And if you know that the biceps also attaches there, then you're golden. Or if you know that the serratus anterior does not attach anywhere near the coracoid, or that the deltoid is like over here away from the coracoid, then you can navigate it pretty easily, even if you don't know the answer straight up. But some of these things are going to be tricky, and other attachment sites are going to be very straightforward. You're going to have to pay attention to like medial and lateral when it comes to the scapula. So questions I've seen have been things like for the teres, which attaches to the lateral lower border of the let me pick a different muscle that we can look at right now. So for like the rhomboid major, here's rhomboid major, here's rhomboid minor. So for the rhomboid major, the question may be, does it attach at the medial inferior border, the medial superior border, the lateral inferior border, or the lateral superior border, right? And you would have to know medial from lateral. You would have to know superior from inferior. Just like we do superior, inferior, lateral, and medial on the body for our orientation terms, you also have to do those for each part of the body. Yes. And then understand the actions of the major muscle groups in the body. So visually, this is not difficult because for me, at least, I hope you guys agree. Hope you guys feel this way too. For me, if I look at the direction of the fibers and where they attach, I get that this lower part of the trapezius attaches to the thoracic vertebrae and attaches to the medial and superior aspect of the scapula. So it's going to draw the scapula down and medially. So it's going to draw it inferior and medial toward the spine and down. So that's depression and a little bit of retraction. So for me, that's not difficult. And if you look at places on the arm or on the femur where muscles attach, some muscles attach to the inside. That means they're going to do internal rotation. So this is the latissimus dorsi. This one functions for internal rotation. The upper trap does not attach to the humerus. It doesn't move the humerus at all. If you look at some of the other arm bones, so I can't blow this up any more than it is. So if you look at this muscle, all these muscles, 1, 2, 3, 4, 5 bellies or 5 strands, 5 groups. This is showing. Oh, here it is. Big one over here. Good job, Prof. So these 5 are all the infraspinatus muscle, and they appear to attach on the back or the outside of the humerus, not the inside of the humerus. You can't really see it because it's covered up by the delt. But if we go back to the latissimus dorsi, the latissimus dorsi attaches here on the medial side, the inside of the humerus, and the infraspinatus is going like this, and it's attaching more to the lateral aspect of the humerus. So it would do external rotation, right? So you have to be able to like deduce or figure these things out by looking at you have to be able to figure out the actions by looking at the direction of the fibers where they attach. And then the last thing that you need to be aware of for actions of the body, actions of the major muscle groups, is just the written or the didactic portion. It's one thing to look at the muscle fibers or feel them on yourself or imagine the muscle fibers or retrace them after, which hopefully you'll be able to do. It's my job to help you learn that. But it's another thing to see a question that says, the coracoid process of the scapula serves as an attachment site for which muscles, and then you have to remember the fibers. You have to remember which fibers go there. And if the question is related to the attachment at the coracoid process, and it's asking you about the movement of the humerus versus the movement of the scapula, then you have to understand the difference between the muscle. You have to understand that muscles that attach to the coracoid move the scapula. Muscles that attach to the humerus, they move the humerus. And some attach at the coracoid and at the humerus, like the biceps brachii, the coracobrachialis. And some don't, like the pectoralis minor does not attach to the humerus. It attaches only to the coracoid process. So there's going to be, that's like a more abstract way for you to answer the question, right? The only way that you're going to be able to answer that question, to answer these questions accurately, is by looking at them regularly and saying and like helping yourself learn these things very thoroughly, which is I think using different cortices of the body, different cortices of the brain. So saying the names, saying where they attach, and then feeling, and then moving, right? So you have the visual, you have the auditory and the verbal, and then you have the kinesthetic, right? You need all of those in order to mix that information, and then your brain will learn it much more thoroughly than just reading it on a page and trying to memorize the words. That's not going to get you that far. I would say that always gets me like less than 50% of the way there for what I have to learn. All right, so let's begin talking about the actual muscles. So today, just so you know where and how far we're going, we're definitely going to cover the extrinsic back muscles, the intrinsic back muscles, and these are the intrinsic back muscles here. This is the superficial group, and then we're going to look at the deep layer of the intrinsic back muscles, and we're probably not going to look at the deepest layers. I may show them to you, but we're not going to go over them the way that we will the multifidus, the rotatorius, the semispinalis, so that you understand. Such that you understand how the multifidus and the rotatorius move the spine. I think we may have gone over those at one point already, but we're going to do them tonight. And then if we have time, we're going to get into these are the rhomboids. We'll do those. We're going to get into the SITS muscles, the sits muscles, and if we have time after that, we'll go down to the glute and the hip, or maybe into the lower leg. The muscles of the forearm, just so you know, muscles of the forearm, I think you are perfectly fine. I think you're safe if you learn the muscles of the forearm as on the ulnar side. So here's the ulna, and I'm sorry, on the radial side, or the, radial side, and here's the ulna over here, radius here, ulna here, ulnar side this way, radius side that way. And if you learn extension, so your radial extensors, or the extensors that are on the radial side versus the extensors that are on the ulnar side, and the flexors that are on the ulnar versus the radial side. Most of the flexors are on the ulnar side, most of the extensors are on the radial side. I don't think you need to get into the names of each and every muscle. So you guys are going to feel at the end of tonight, or at the end of this lecture, you're going to feel like you're not taking anything in, like you're saturated, and that is fine. I'd be interested to know along the way when one or two of you start to feel that way. And I think once there's consensus that, like, between two people feel that way, maybe we'll move on to something else at that point. We're going to start with didactic, and then we're going to go back and we're going to do movement. All right. So the extrinsic or superficial back muscles, they're superficial on the back. They're right under the skin. Extrinsic back muscles are always superficial. The extrinsic back muscles start on the upper limb, and then they attach to the spine. They are the trapezius. So that's the upper trapezius, the middle trapezius, the lower trapezius. The latissimus dorsi, another big muscle. I think it may be the biggest muscle in the body. The levator scapulae muscle, levator scapula or scapulae muscle right here. Right, and then the rhomboid muscles. There are two rhomboid muscles: a superior, a minor and a major. So the superior rhomboid is smaller, and the major is the bigger one. That's the superficial layer for the extrinsic back muscles, and then for the intermediate layer, it's the serratus posterior muscles. So it's the underneath here. There's a serratus superior, and then down here you can see another serratus muscle, which is the serratus inferior. Serratus posterior inferior, serratus posterior superior. Definitely want to know that the serratus posterior muscles are part of the intermediate layer. I have seen that as a practice question, where they list the serratus posterior superior, the middle trapezius, the rhomboids, and the levator, and they say which one is the intermediate layer. And so you definitely want to know which are superficial and which are intermediate. All these muscles, you don't need this, although it's kind of interesting if you're interested in it. Okay, and then the deeper intrinsic muscles, we'll go over these again, right? So I just want to listen for you one more time. It's the splenius muscles, so splenius capitis, splenius cervicis. You can see, I think, part of the splenius capitis here. Splenius cervicis is deeper inside. Capitis, capo meaning cap or head, cervicis meaning cervical. And then the erector spinae muscles, also called the spinal erector group, or SEGs, also called the ILS, the I love sex muscles in my class only, the iliocostalis, longissimus, and spinalis muscles. Then you have the deeper layer, you have the semi-spinalis muscles, multifidus and the rotatories. Multifidus and rotatories definitely are important. And then the deepest layers, I don't see them asking you about that. Interspinalis and the intertransversarial muscles. But if they mention the intertransversarial muscles, if they do, you're going to need to at least be familiar with them. Okay, let's go down one slide and see what's on that next slide. So we're going to take a look at the extrinsic muscles, So we're starting with the superficial layer. That's the trapezius, latissimus dorsi, levator scapula. The rhomboids. Where's the rhomboids? How come my rhomboids are not listed? Trapezius, latissimus dorsi, levator scapula, and the rhomboid muscles. Levator scapulae muscles and the rhomboid muscles. So on this slide, we're looking at just the rhomboids are pictured here, right? And then on the next one, we'll look at the levator scapula and then the trapezius. So in green, you have the superior rhomboid, I shouldn't call it the superior one. So one that I always remember it's superior because it's up top, but it's actually the minor. So it's the rhomboid minor and then the rhomboid major. Rhomboid minor and then a rhomboid major, and they're just named by their size, right? Minor is small and major is larger. And over here you see the muscles in context. So you have the rhomboid minor here, and you can see it more clearly with like the splenius and the levator muscle here, and here's the fibers of the upper trap over here, right? And then over here you have the rhomboid major, and you can see that below with rhomboid minor, rhomboid major. You can see where they attach on the scapula. There's a difference with the scapular attachment. One is more inferior, one is more superior, right? But you can imagine that these muscle fibers, the way that they're moving, they would retract the scapula, and there would also be a little bit of what? Elevation or depression of the scapula. Somebody unmute and call out. Elevation, like pulling the scapula up superiorly, or depression, pulling the scapula down inferiorly.
Can you repeat
Somebody
the question?
tell me.
Can you repeat the question?
Yes. First of all, can somebody who heard the question unmute and answer? Going once, going twice. No. Okay. So the question is, the fibers of the rhomboids, would they elevate, pull the scapula up, or depress, pull the scapula down? Nobody?
I think it would be pulling it up.
It would definitely pull it up, definitely pull it up. And you should be able to tell by how? How can you tell?
No, I just see it because it's
The way
like,
that it's
What?
attached.
The way that it's attached, but I think what you mean, Sandra, is the direction of the fibers. The fibers start on the inferior or the lower aspect of the scapula. Let's just look at this line here. They start on the lower end of the scapula, and they move in a medial toward the spine. They move in a medial direction, but also a superior direction. They move up. They're slanted upwards, right?
Right.
And likewise for the fibers on the top, on the upper part of the scapula, like if you look at the rhomboid minor, they also start lower than they attach at the spine, right? And which one do you guys think, so they would pull the scapula upward. Which one do you guys think is the more stable end? Would it be the spine or would it be the scapula?
The spine.
The spine, that's right. And which one would be the more movable end, the scapula or the spine?
Scapula.
The scapula. So which is the insertion and which is the origin? The origin is what? The spine or the scapula?
Spine.
The spine. And which is the insertion, the spine or the scapula? The scapula. That's correct. Does anyone not understand this specific muscle? Please speak up if you do not understand. Okay, so that's the rhomboid muscles, the superior and inferior rhomboids. The other muscles are pretty easy. I left the other muscles on a larger. I'm just using this larger graphic for these other muscles because I think you guys can handle discerning these muscles this way. So let's start at the top and go to the bottom. Okay, so here's a muscle I don't think you need to worry about, the obliquus capitis superior muscle. This, I'm not even sure what group that's part of. I'm guessing it's one of the deltoid muscles. Obliquus capitis superior, rectus capitis posterior, obliquus capitis inferior. Forget it. And then there's the rectus capitis posterior minor. I mean, what the hell is that? They're not going to ask you those muscles. Keep in mind, I could be wrong, but I would bet dollars to dimes that they're not going to ask you about the rectus and the obliquus capitis muscles. All right, so at the top you have let's start over here because this is more superior, this is more inferior. So you have the upper trapezius muscle. You have the upper trapezius muscle. See, it's marked as trapezius, and you have the upper fibers, and then you have the middle fibers. So I called this the middle trapezius. And then you have the lower trapezius from here down to here. So this is the lower trapezius. Superior, middle, or upper, middle, and lower trapezius. You can tell that the upper trapezius, because it attaches to the skull, it attaches to the vertebrae, it attaches to the scapula. What's this part of the scapula called right here? This part. It's an important structure because it divides the superior and inferior. So you have the supraspinatus muscle above it and the infraspinatus muscle below it. So this is the spinatus aspect of the bone. And what do we call that in just common English? The what of the scapula? Let's see. Dominique. Hey, Dominique, how you doing? So
Not
what
the
is
best, but no need of complaining, right?
okay? I'll make it quick and painless. All right. So what is this? What is this called? If you have the supraspinatus above and the infraspinatus below, what is this aspect of the bone probably called? The what of the scapula? The spinatus of the scapula, or commonly called the what of the scapula? Short for spinatus. Shorten the word spinatus to a common term. A book has this, and also the backbone is called this. Short for spinatus. The spine of the scapula.
I don't know.
Yeah, well, that's why I asked. In part, when I ask someone, I hope they don't know, so that we can go over it a couple times, right? Because that's how you learn, truly, by making mistakes. The stuff you come into the class knowing, you're not learning that. You already know it. So it's the spine of the scapula. Above the spine is the supraspinatus. Below the spine of the scapula is the infraspinatus muscle. All right, and the thank you very much, Dominique. And then you have the spine of the scapula also has attachments for the upper trap and the middle trap, and some for the lower trap. So you have the spine of the scapula. So given that the trapezius muscle attaches to the spine of the scapula and to the skull and the vertebrae, I would say that the spine of the scapula is the insertion, and this is the bone that's going to move the most, and that the vertebral column is the origin. And maybe you could say that the skull is also an insertion rather than an origin, but I think the point is kind of like not really worth discussing. But you can see that these fibers would tilt the head laterally. They would tilt the spine laterally, lateral spine flexion in the cervical spine, and they would draw the scapula up and toward the spine. So there would be a tiny bit of retraction for the upper trap, a lot of retraction for the middle trap, and there would be elevation for the upper trap, no elevation or depression for the middle, and then there would be more depression for the lower trap with some retraction. So depression for the lower, retraction for the middle, and elevation for the upper. Okay, then you have the latissimus dorsi muscle. We'll do the lat, and then we'll come back and do the levator scapula. You have the latissimus dorsi muscle, which also attaches to part of the thoracic spine. It attaches to the lumbar spine, attaches to the sacrum, attaches to the ischium. This is the biggest muscle in the body, I believe. And it's definitely one of the most important and one of the most neglected. You're going to see a lot of people who have shoulder pain because they don't use their latissimus dorsi muscles that much, which the best way to use your lat is to place your arms over your head and to pull. So an overhead pull like that. And then the insertion is at the medial aspect of the humerus, so the inside of the arm bone. So pulling on the inside of the arm bone, first of all, would bring the arm bone downward in a downward motion, and also would internally rotate the arm bone a little bit. The latissimus dorsi has three directions or three sections, just like the upper, middle, and lower trap. There's an upper, middle, and a lower latissimus dorsi, but they're almost never discussed in that way. So this upper part, which I think is called like the humeral or the humeral scapular part, it moves the humerus and also part of the scapula. It has attachments at the scapula that covers the tip of the scapula. And then the middle part, which is more concerned only with the humerus and with the thoracic spine, moves the humerus and the thoracic spine. And then the lower part, which is like the lumbar and pelvic part, that part stabilizes or holds the pelvis still and stable, and also can lift the pelvis. So if you were to elevate one half of the pelvis at a time, like raising this hip up, closing this space here, that would be the job of the latissimus dorsi. And then you have on the other side, starting at the top, you have the levator scapula muscle. So levator scapula, just like the name implies, levator is elevation or levitating, lifting. And then scapula, levator scapula muscle is the scapula, so lifting up the scapula. So you can see that these fibers attach, looks like they attach at the cervical spine only. I can't tell if it attaches at the skull, but it doesn't really matter. Cervical area, right? And then there's an origin down here at the scapula. I think this is the insertion and this is the origin. Yeah, I think the scapula is the insertion and the cervical spine is the origin. And you can tell from the fiber directions and from the name, levator scapula, that it's going to elevate the scapula. Then you have our friends, the rhomboid superior and rhomboid minor and rhomboid major, And then you have, those are all the shallow muscles. And then you have the intermediate muscles, which include the serratus posterior inferior, and obscured or covered by the rhomboids are the serratus posterior superior. We'll see those in a minute. Okay, so the serratus posterior superior can be seen right there, right? So at the top layer of these like rhomboid shaped muscles are the serratus posterior superior, followed by the rhomboid minor, followed by the rhomboid major. First, you guys look at the shape of a rhomboid. So a rhombus or a rhomboid is shaped like this, right? I guess, yeah, so this would be like on the left. This would be like on the left, right? On the left side, to be going this way, right? So a rhomboid is shaped like that. And then if we were to look at the serratus posterior, superior, and inferior, we would see the fibers very clearly. Serratus, where are you, serratus? Yes, serratus posterior muscles. You see the fibers very clearly are slightly underneath the rhomboid superior, rhomboid minor, and above the rhomboid minor. Right, they're up here, and then down at the bottom. Oh, they only have those two. Okay, and then down at the lower part of the rib cage, the bottom of the rib cage, are the serratus posterior inferior. And then if we look at them in context of the whole, like from head to pelvis skeleton, you see the serratus posterior superior peeking out up here from underneath the rhomboid minor. And then you see the serratus posterior inferior down here. which is revealed when we cut away the latissimus dorsi and the lower trapezius muscle. Okay, let's see. So that's all of the superficial layer. Did I just put those back in there? I just put those. Oh, okay, it must be. It's just cut off on each slide. I didn't know. All right, so we looked at the trapezius, the latissimus dorsi, the levator scapula muscle, and the rhomboid muscles. So if I said which muscle elevates the scapula, which of these? Let's see. Khalik. Actually, everybody unmute. Everybody unmute. So if I said which of the following muscles elevates the scapula, is it the levator scapula, the rhomboids, or serratus posterior inferior? Which elevates? The levator scapula, the rhomboids,
Levator
The levator.
levator scapula. And Sandy, remember that the levator scapula, the name means elevating the scapula. Also remember that the fibers of the levator scapula, they attach to the top of the scapula and then way up to the cervical spine. There would be a lot more elevation of the scapula from the levator muscle than for the rhomboids. And if I said, of the two, the levator scapula and the rhomboids, which one would do more shoulder blade retraction? Which would bring the shoulder blades towards the spine more, the levator or the rhomboids?
Rhomboid.
The rhomboids, yes, very good. And then if I said, which one would depress the scapula most, the rhomboids or the lower trapezius? What would the answer be?
Lower trapezius.
Lower trapezius, that's right. Which one would function in side bending? Would it be the latissimus dorsi muscle or the serratus posterior inferior?
The latissimus.
The latissimus dorsi. And which one functions in the internal rotation of the humerus? Would it be the latissimus dorsi muscle or the upper trapezius muscle?
Latissimus.
That's right. Which one does internal rotation, latissimus dorsi or infraspinatus? Latissimus dorsi or infraspinatus? Which one does internal rotation?
Infraspinatus.
The
Which one you
infraspinatus
say,
attaches internal rotation. It would be the latissimus dorsi. Correct, because it attaches to the medial part, because it attaches to the inside of the humerus. The infraspinatus attaches to the outside of the humerus. Okay, are you guys, is anybody not ready to move on from these? Does anybody need to drill these a few more times?
I just got confused with the internal rotation.
Okay, let's look at the sits muscles then. SNTS. No. Shoulder. No. Where's my shoulder? Shoulder. Yay. Okay. Let's look at the sits muscles just for a second. All right. So if we look at the muscles of the shoulder, what we see are that some of them attach to the lateral or the exterior, not exterior, I'm sorry, to the lateral aspect of the humerus, and some attached to the medial aspect of the humerus. So you have to imagine the humerus here without the triceps. All right. Here's the latissimus dorsi muscle, right? Here's the teres major muscle. Both of those muscles they're headed right for the humerus and they attach to the inside, to the medial aspect of the humerus. Right? If they attach to the medial aspect of the humerus, can you imagine how that would draw the humerus toward the body? It would adduct the humerus toward the body. First of all, can you imagine that? And can you also imagine how those muscles, how those muscles would also rotate the humerus medially, rotate it internally a little bit?
Rotate it.
Yeah, okay, maybe we'll look at that again clearly. So can you imagine how this muscle fiber here of the latissimus dorsi attaching to the medial aspect of the humerus, can you imagine how that would rotate it this way? Would rotate it clockwise or internally?
Okay,
Can you imagine that?
a little bit. So it's kind of like
Okay.
turning.
Lat attach, let's see, lat insertion. Yeah, it does. It would do some turning. Everybody's a critic, man. We're looking at the latissimus. We're looking at anatomy. There's no fun is allowed. No fun allowed. Oh goodness gracious, he's really not having fun. Okay, here's let me see if I can find a view of the lat from the front. There's one up there which is kind of like a so we're gonna have to go with this one won't be so bad. Just close that. Go close that for a second. Okay, we're gonna have to go with this one. Wikipedia. Well, would you look at that? Latissimus dorsi. So if we look at the fibers of the latissimus dorsi, this is definitely worth spending time on, by the way. If we look at the fibers of the latissimus dorsi, what we see is, in a way, I wish it weren't, I wish it were not moving. Can we stop it? No. What we see is that the fibers attach to the inside and a little bit to the front, right? So it's not the humerus is not so large that there's like, 2 inches from front to back. It's like a quarter of an inch, half an inch from front to back. So it's kind of difficult to say whether it's the front aspect, the anterior aspect, or the posterior aspect of the humerus. But in this kind of abstract artist rendering, maybe you can tell that it attaches a little bit to the front.
Yeah.
Right. And it's definitely on the medial side. So you can see if it were attached to the back, it would wind this bone. It would wind the bone externally this way, like the bone would be pointing that way. Right. But since it's a little bit on the internal aspect, it winds the bone. In this case, it would be medially. Right. So this one is rotating. This one would be rotating clockwise, like this, rotating like this. And this one would rotate counterclockwise like that. Is that clearer?
Yeah.
Okay, great. And then if we look at some of the latissimus dorsi, here's one from Gray's Anatomy, which is like seriously like the most abstract stuff you can ever deal with. What they're showing is this is the arm bone right here. This is the arm bone, and it's elevated like the arm is out and like a T shape. If you look at me, like the arm is out, like you're doing like a big hug, right? So the arm is abducted to 90 degrees, And this is the humerus right here. The humerus goes like this. And what they're showing is the latissimus dorsi has attachments that go to the medial aspect. And I think this would be a branch that goes slightly internally. And here's the clavicle, here's the pec major. This is probably the, I don't know what muscle that is. Probably one of the deltoids. Again, it's pretty that I don't understand this. I don't understand the Gray's Anatomy ones as well as the others, and that's probably why I was a. That's probably why I was a ditch digger in the last life rather than a doctor or whatever. So that's latissimus dorsi, and then if we look at the infraspinatus, say that again. If we look at the sits muscles, supraspinatus, infraspinatus, teres minor, and subscapularis, we can see that those attachments are almost all of those attachments are on the outside. So here's the infraspinatus, and here's the teres minor. There's the teres major. Teres major is not one of the sits muscles. It's not one of the shoulder girdle muscles. The shoulder girdle muscles are the teres minor. Infraspinatus above that, the supraspinatus above that, and then the subscap on the front. So the infraspinatus attaches to the posterior aspect of the humerus and also a little bit to the side, And that results in an external rotation because it's on the back and a little bit on the outside, whereas the lat, much like the teres, was on the inside and a little bit to the front. This is on the outside and a little bit to the back. So it pulls the arm bone this way. This arm bone would be capable of rotating clockwise in this case, which would be externally in this case. Okay, is anyone completely, totally confused? Anybody completely, totally confused?
A little.
Are you raising your hand, Dominique? Okay. So what I want us to do is now to transition to the kinesthetic portion for these muscles. We are going a little bit out of order by skipping from the extrinsic back muscles into the sits muscles, but this is fertile ground for learning because we have to do these eventually. So, and you guys are curious about them now, so we might as well do them now. All right, so I'm just going to use my FaceTime camera since I've already got that queued up. So first thing is to feel the latissimus dorsi muscle. So I want you to raise your arm up, and then if you find your armpit, there'll be a muscle like on the posterior aspect of your armpit. I'll do this one because it's lit. On the posterior aspect of your armpit, you come to this like edge, right? That's the area where the latissimus dorsi is. And if you pull your arm and your shoulder blade down, the latissimus dorsi muscle starts to, God damn it, not enough light, too much light, not enough light. If you pull your shoulder blade down, the latissimus dorsi muscle starts to pop out, okay? So there's latissimus dorsi right there, this tiny, tiny little latissimus dorsi muscle. So you find your armpit, go down a little bit,
Great.
Right? And you can also find the bottom of your shoulder blade and wrap your finger around and then try to depress your shoulder blade. You feel the fibers of the latissimus dorsi popping there. Somebody say no if you don't feel them. Great, so everybody feels them, awesome. And it'd be nice if you guys like turned your cameras on for this. You don't have to, but it would help me somewhat. So that's the first one is shoulder blade
We
depression.
may not
for
look as
latissimus
sexy
dorsi.
as you.
Well, just had to go there, didn't you, Sandy? Thanks a lot. Gee, I wasn't uncomfortable to begin with. All right, yeah. Anyway, thank you very much. Encantado or whatever. So we have the external rotation. We have the external rotation of the arm bones. So this
Perhaps
is
not stink.
spinning. What's that? What? More sexy jokes? Listen, I'm taking the hit for the team over here. All right. So you guys be nice to the old man. All right. So we have this external rotation. God damn, the light. with external rotation, right? So if you look at my elbow and imagine the humerus, it's rotating externally or laterally away from my body, right? So external rotation. External rotation, and we have internal rotation. Think about turning the elbow that way, the palm coming down. So does anyone not understand how to externally rotate or how to internally rotate? Yes, that is correct. Sandy, that is, I think, I can't see your elbow, Dominique, but you probably have it. I think I saw you have it. So that's like internal rotation. All right, so now go back to the fibers of the lat. Right under the armpit, under the inferior border of the scapula, put your hand there. And now let's see if you can feel any of the fibers very subtly as you start to turn inward. Right about here, they start to really turn on. You guys feel those? So you say yes if you feel them.
Yeah.
Yes, sir.
Yeah.
Okay, great. Great. And if you don't feel them, you can give yourself a little resistance. You can hold your wrist and really try to turn against the resistance of this hand. You should be able to sense that. Okay, so there's the internal rotation there of the latissimus dorsi, and the internal rotation of the humerus, and also the depression of the scapula. All right, then you got to feel the external rotation. We got to feel the external rotation of the teres minor and the infraspinatus muscle. So to feel that, we take our hand from under the arm to over the arm, and we go to the medial border of the scapula. Here's the scapula. Right? And we go along the scapula, along the body of the scapula. See my shoulder blade, everybody?
Yeah.
Go along the scapula, and there's like a meaty muscle there. Oh, by the way, while we're here, let's see if you guys can find the spine and scapula, especially the ones who are cracking wise about my body. Ha, payback time, suckers. So you can find the spine of the scapula. Yeah, laugh it up. So you get the spine of the scapula right here, right? So you feel that bone, it goes right along here. It's right along here. You feel it? Yes, no?
Yeah.
Great. So below is the big muscle, that's the infraspinatus, and above is the smaller muscle, that's the supraspinatus. We'll do the supraspinatus movement in a minute. So go below the scapular spine, say to yourself scapular spine, go below the scapular spine. Now you're on the infraspinatus. So we just did this internal rotation. Now we're going to do some external rotation. So go as far as you can, rotate externally as far as you can, and you should feel those muscle fibers, the infraspinatus, definitely contracting. You feel those?
Yes.
Okay,
Mhm.
great. Is that concentric or eccentric contraction of the infraspinatus?
Concentric.
Very good. Okay, now let's do the subscapularis. Let's do the supraspinatus. So we did the infraspinatus. Come back up to the scapular spine, find your scapular spine. All right, and now come above the scapular spine, and now you're on the supraspinatus, infraspinatus, supraspinatus. So the supraspinatus does more elevation. So all you have to do is put your arm on your side and then start to lift it up. And the supraspinatus is most active from 0 to 90 degrees. And then from the supraspinatus, place your thumb on the upper trap. So you have the supraspinatus more posterior and your thumb, the upper trap, more anterior. Feel the difference in contraction between those two. So supraspinatus to 50 degrees, 90 degrees, from 90 degrees upward is the upper trap. So go like this, and you can feel the one under your thumb, the upper trap. You'll feel the upper trap contracting under your thumb. When the arm is higher, you'll feel the supraspinatus contracting under your fingers hips when the arm is lower. Supraspinatus region, upper trap region. You guys feel the difference?
Yeah.
Nice. Okay, and then we might as well do the teres minor because we're here because we're here. So to find the teres minor, you go back to this lat grip, right? We're doing this kind of lat grip past the below and past the axilla. Find the tip of your shoulder blade. All right, now you should have your fingers on the tip of the shoulder blade and your thumb's going to be up here. So your teres will be a little bit under your thumb. It should not be on the infraspinatus. It should be off of the bone, right? And for the teres minor, you can feel it by externally rotating. And it's a smaller muscle, and it's a little bit difficult to feel, but if you press with your thumb, or now I'm going to substitute my fingers for my thumb, right? I can feel it. I can definitely feel that muscle. The infraspinatus is also contracting. So you should feel that muscle there when you externally rotate.
Mhm.
All right, guys.
Yes, sir.
I'd be wondering what be going on with that one. 'Cause- Oh.
Are you clear now, Dominique?
No, I was just saying because I'm double jointed, as they call it. So I'd be wondering what be going on with my arm that everybody can't do. I don't know.
Well,
I'm just
yes. Well, as long as you can, with some certainty, like palpate and rotate and lift, elevate and depress, and feel those muscle fibers during the test, you will be golden for the test. But yeah, double jointed is unique and does present some stability challenges. Okay, guys. So it's 7:04. Let's do a little bit more. Okay, just a little bit more. I hope you guys are not fried. Let's do just a little bit more, and then we'll move on. Then we'll take a break and move on. All right. So we did levator scapula, serratus posterior superior, rhomboid minor, rhomboid major, right? Upper, middle, and lower trapezius muscles. We did the latissimus dorsi muscle. We have not done the serratus posterior inferior muscle. Forget it. And then we did some of the sits muscles. Let's move on to the let's finish up the shoulder girdle. Okay, so if you go to this video, it's called kinesio shoulder, or to shoulder muscles and bones. Like either one of these will be fine. If you go to one of those, you can find quite a lot of information on the shoulder sits muscles. While we're scrolling through, let's look at we're on the way to the sits muscles, right? Let's look at the serratus anterior. So what we're looking at here is the rib cage from the right. The arm the humerus would be connected to the glenoid fossa right here, and it would hang down like that, right? And then the side of the face would be like here, with the nose over here, big nose. And then this is the front of the chest. This is the front of the chest. So we're looking at the person from profile, and we can see the attachment of the serratus anterior muscle from the tip of the scapula up through the medial border of the scapula, and then going to the ribs, the costa, going to the ribs. And then after that, there's a good graphic of differentiation between the pectoralis major and pectoralis minor. This is the best. This is from Janet Travell's trigger point manual. This is the best differentiation of those two muscles I've seen yet. Not that they're complicated, but hey, it's nice when things are simple and clear, right? So this is the pec major, and you can see that the pec major has
Are you
attachments.
sharing your screen? I can't see anything.
You can't see anything?
Yeah,
Oh,
I can't see him.
Well, I see you, but
yeah. Yes, and I'm sexy. But anyway, so we have the serratus anterior, right? So we have the inferior border of the scapula, the medial border of the scapula, right? We're looking at this whole person from the sides, from the profile. So the arm would be here, hanging down. Here would be the front of the chest. The head would be up here, and the nose would be this way. Right, so here's the serratus attaching to the medial border of the scapula and the tip of the scapula, and then attaching to the ribs, the costa. And then here's the pectoralis major muscle. They're not showing the pectoralis major muscle attaching to the clavicle, and I'm pretty sure that it attaches to the clavicle, but oh, this is a branch of the pec The pec major. Yeah. That's to show you, and this is the pectoralis minor. Yeah. Okay. So here's the pectoralis major, which you can see has a clearly like separated or differentiated clavicular branch that attaches to the humerus, and then a sternal branch and a kind of a rib branch, and all those converge on the humerus. Remember, this is a convergent muscle, right? They start wide and they converge narrow onto the humerus. So the pectoralis major, then, because of where it attaches to the front and the outside of the humerus. The front, slightly to the outside of the humerus, would internally rotate the humerus and also would be capable of shoulder blade protraction, or humeral, what's that called? Humeral flexion. It's like, yeah, humeral flexion. So we're talking about some pushing the arm forward and some protracting shoulder blades apart. So that's the pec major. And if we look at the pec minor, if we look at the pec minor, we can see pec major attachments here at the clavicle and the sternum. And that is one of the practice questions I saw, which one has attachments at the clavicle and along the whole sternum, and also attaches to the humerus. That's the pec major. The pec minor doesn't attach to the sternum or the clavicle or the humerus. It attaches to the ribs, rib 3, 4, 5, and then it originates at ribs 3, 4, 5, and it inserts on the coracoid process. So attachments at the coracoid and on the ribs. I remember there was a question that we started with, you know, which of the following muscles has attachments at the coracoid process? And then there's a Ken Hub. Here's the same pectoralis minor from Ken Hub. Okay. A question. Yeah, this is a perfect example of a question, which I don't think they're going to ask you, but which muscle stabilizes the ribs when the scapula is fixed in one position? This is from Yugo Prep. I don't think Yugo Prep is the most reliable site. They're a good site, they're good enough, but I think that some of their questions travel a little bit too in depth. So which muscle stabilizes the ribs when the scapula is fixed in one position? First of all, what does the question mean? I had to think about this so long. What does it mean, fixed in one position? All right, the scapula moves 4 different directions. It doesn't specify which position it's fixed in. Plus fixed, the concept of fixed, you mean like stabilized, packed? Which one are you talking about? And I think what they mean is when it's being held in protracted position, which muscle then acts to keep the ribs from moving? And the answer is the pectoralis minor. And I think the best you can do with this is by thinking, okay, which one attaches to the ribs and the scapula? And the scapula, remember, it's not just the back of the scapula, it's also the front of the scapula, the inside and outside, the medial and lateral portions of the scapula. So the pectoralis minor attaches to the front, like the coracoid of the scapula, and also to the ribs. Pec major, recall, does not attach to the scapula. It has some rib attachments, but it doesn't attach to the scapula. Trapezius is on the wrong side of the body. Serratus anterior superior, serratus anterior, that's really tricky because that does attach to the scapula and to a bunch of the ribs, but they're asking about the function. When it's fixed in one position, when the scapula is fixed in one position, which muscle more or less fixes or stabilizes the ribs? What a tricky question. What a tricky question. So, okay. Okay, let's go over the shoulder joint, the humerus and the shoulder and the scapula. So what we're seeing right now is the posterior aspect. What's this thing here called, guys? What's this thing called?
The spine.
The spine of the scapula. That's right. That's right. What goes above the spine of the scapula, Dominique?
What you say? Sorry. My son was
Dominique,
doing
what goes
something
ab-
in the background. He distracted me.
I totally understand. Which muscle goes above the spine of the scapula? Would it have in its name, in addition to spinatus, there's two spinatus muscles. Would it have it in its name superior or inferior? If it's above the spine.
Superior.
Yeah. So what muscle has in its name both superior and spine for the sits muscles? It changed the words up a little bit.
That was a good example.
Superior spine muscle versus inferior spine muscle.
Yeah.
So it's supraspinatus,
Yeah.
supraspinatus, and then infraspinatus. Okay, so spine of the scapula, and then you have the humerus, right? And you have this bone, this big ball in this small socket. And here are some things that I want you guys to notice. First, you have the belly of the infraspinatus attaching to the back of the scapula. You have the supraspinatus belly attaching to the back of the scapula. And then the infraspinatus attaches over here to the lateral and posterior aspect, the lateral and the posterior aspect of the greater trochanter. See this big bump? Not greater trochanter, of the humerus. Greater trochanter is on the femur, I believe. This big bump here is called the tubercle, the greater tubercle. There's two tubercles, a greater and a smaller one, and the biceps tendon is in between. So the greater tubercle, this big bump on the humerus, has on the posterior aspect the infraspinatus, and then a little further back the teres minor. So you have the teres major attachments down here, teres minor attachments up here, and then the teres muscle would go from the lateral border of the scapula up to the posterior aspect of the humerus, attaching on the greater tubercle of the humerus. And then up here you have the supraspinatus muscle. So it's SIT. It's SIT on the greater tubercle of the humerus. I know the greater tubercle is a new vocabulary word for you guys, but you got to know greater and lesser tubercle. You don't have to know all the bony aspects of all the like attachment sites, the bony aspects of the bones, but I want you to know the greater and lesser tubercles, because I have seen those on practice questions. So you have the teres, and then in front of the teres, the infraspinatus, and then anterior to the infraspinatus, the supraspinatus muscle attachments on the greater tubercle. And if we advance to the front side, you see there's there's the supraspinatus muscle attaching to the greater tubercle right here. And then over here, there's the lesser tubercle. Here's another bump right here, a lesser tubercle. All right, and the lesser tubercle has the subscapularis muscle. So this is the front and a little bit on the inside. So hopefully you can envision how the subscapularis, here's the attachment of the subscapularis, the origin of the subscapularis, and the fibers would come like this. Here's the front of the scapula. Notice there's no scapular spine, and there's the clavicle in front, and the core cord process. This is the front. So this is the front of the scapula, anterior portion of the scapula. The subscap would come up here. Fibers are going like this. All right. Hopefully you can imagine that the subscap inserting there on the front and a little bit medial would internally rotate. It would rotate the bone this way. All right. Now you have the greater tubercle with the supraspinatus on the top. You have the posterior view of the greater tubercle with the supraspinatus on top. Trying to help you guys get oriented. Here's the anterior view again. Greater tubercle with the supraspinatus on top. And then subscapularis on the lesser tubercle, and between there's a groove, and this is called the bicipital groove. Bicipital groove. The biceps are groovy. Bis for the guys or curls for the girls. I'm making no sense. Anyhow, the biceps are groovy. They sit in a groove. And if we look at those bones from a superior aspect, superior, where's the superior view? If we look at these bones from the superior view, what we see is like if you sliced see, this is not entirely accurate because this bone is in this drawing, it's too low down. It's like they took this clavicle and they put it right here and then they sliced this way. I hope you guys can see that. So, but basically they're slicing through the very top of the humerus like this, slicing through the top of the humerus and part of the, oh, maybe that's a scapula, not the clavicle. They're slicing through part of the scapula and you're looking down. So you're standing above the patient is seated, you're looking down and you're seeing the top of the humerus bone. And you can see that there's like a bump on the humerus bone. There's a big bump and then there's a smaller bump. And this part is kind of round, right? And then there's a bump. So this is the greater tuberosity and the lesser tuberosity. And then between there's a ridge, a groove, a valley, right? So you have the biceps groove, the biceps tendon in the biceps groove. On the front would be the attachment. Since this is front and more medial, this is more lateral and then more posterior. Since this is front and more medial, this would be the subscapularis attachment. Then over here, the more lateral aspect would be the supraspinatus, followed by the infraspinatus, followed by the teres minor, all right? The reason I take you through all of these is because I did see a question asking about the greater and lesser tuberosity, and that did kind of spook me. I do want you guys to be prepared to answer that question. But also, once I started teaching this, I realized this is a great way in order to understand which way those muscles rotate the arm bone. And I think we can say it is a failing of both of our professions that they don't really teach us this very clearly. They're just like, this one rotates it in, this one rotates it out. Here's your test, good luck. And that really sucks. One last view of this, and then we're going to take a break. So here we have the arm bone removed from the shoulder socket, removed from the skeleton. And you're looking at this from two different perspectives, slightly different perspectives. You're standing at the side of the client, This is the right arm. And you're looking at the side of the arm. And if you step around to the front just a little bit, you can see the front aspect. And then if you step around to the back, look at the side of the arm, but lean around a little bit so you're looking at it from the back just a little bit. This is the posterior aspect. Is anyone not oriented? Is anyone not clear on this being a little bit posterior side view and this being a little bit anterior side view?
Me.
Everyone is oriented? Okay, so imagine in your mind, imagine that you're looking at a client from the side, right? You're both seated, your heads are at the same level, and you're looking at the client's arm right from the side, like the lateral deltoid is facing you. Got it?
Got it.
Got it, Sandra? Okay, so now imagine that you step around a little bit, half step to the front. Circle around to the front just a little bit. So now you can see a little bit of the pectoralis muscle on one side and a little bit of the front of the shoulder. You can't see the back of the shoulder or the shoulder blade. Got it, Sandra?
Okay.
Okay, now come back to the lateral delt. So you're right at the side, right? And now circle posterior just a little bit, step around toward the back of the client so you can see the side of the shoulder And now you can see the posterior aspect, their posterior deltoid, and you can clearly see their shoulder blade. You cannot see their pectoralis muscle.
Got it.
Okay, great. Now we're all oriented. So now look at this first one where you're standing a little bit to the front, the side, and a little bit to the front, and you see the supraspinatus tendon attachment. Supraspinatus would be going this way. Supraspinatus above the spine. And then there's the subscapularis on the front and medial portion, and then between them is the biceps tendon, biceps groove. Interesting, look what's right below the biceps. Latissimus dorsi, That comes this way, wraps around from underneath. It's kind of interesting, right? Deltoid attaches all the way down here. Okay, and then step around to the back a little bit so you can see the shoulder blade in the back, and you have the supraspinatus on top, the infraspinatus below that, and the teres minor below that. Teres minor, infraspinatus, supraspinatus. Okay, so remember I told you guys you're going to be fried. So far we've done the extrinsic muscles of the back. Let's review that the extrinsic muscles begin on the arm and scapula. That's the upper limb, and then they migrate toward the spine. The intrinsic muscles, they begin and end on the spine. They also have attachments at the skull, the costa or the ribs, the ilium and the pelvis. And then there are two layers to the extrinsic muscles, superficial layer and the intermediate layer. The superficial are the trapezius, latissimus dorsi, levator scapula, rhomboid muscles. The intermediate layer are the serratus, posterior muscles. And then all those muscles that attach to the shoulder, the infraspinatus, supraspinatus. It says participants can now see my screen. Did the screen just appear for you guys, or has it been there already?
It's been there already.
Okay, good. The muscles we took a look at for the shoulder are the supraspinatus, infraspinatus, teres minor, subscapularis. Those are the sits muscles, or the proper muscles of the shoulder. The teres major is an internal rotator, not considered one of the shoulder girdle muscles, but does act on the shoulder. Also acting on the shoulder is the pectoralis major on the arm bone. Acting on the ribs and the scapula are pectoralis minor and the serratus anterior. And also acting on the arm bone is the latissimus dorsi, which also acts on the shoulder blade, the back, and like the ilium, I would say, yeah, ilium. So it can close the side waist, it can close the side waist. So onward now to the superficial and the deep layers of the back. I won't spend a lot of time on superficial because we already covered those at one point, but the superficial are the muscles of the neck, which are the splenius muscles, and then the muscles of the back, which are the ones we think of as the back muscles proper. So the neck muscles are the splenius muscles, splenius capitis attaching to the skull or the cap or the capo, splenius capitis muscles, and then splenius cervicis muscles attaching cervicis to the cervical spine. And then after the splenius muscles, lower down you have the erector spinae muscles, also called the spinal erector group or the spinal erectors. Some people call them the extensors, the back extensors, lumbar or thoracic extensors. Good mnemonic is I like sex. So that's the iliocostalis, the longissimus, and the spinalis muscles. And if you go from, if you touch the middle of your back, hold on a second, stop, share. So if you touch the middle of your back, right next to the spine, and then you migrate laterally, a good kinesthetic way of studying those is to get on either side of the spine, and then that's your spinalis muscles, right? So spinalis, and then out from that are the, wait, make sure I get this right. Out from that is either the iliocostalis or the, yeah, out from that is the longissimus, and then out from that out, and then further out are the iliocostalis. So it's spinalis, and then longissimus, and then iliocostalis, right? Spinalis, and then longissimus, and then iliocostalis. So it's I on the outside, L, and then S on the most inside. So I, L, S, right? So that's not a bad way to remember it. You do need ways to remember all this stuff. There's so much stuff, so much stuff, and just like you might remember all three of these, but remembering which, remembering the order, definitely need some help. Okay, so they're not going to ask you, I will bet dollars to dimes, they will not ask you to differentiate between the iliocostalis cervicis, the iliocostalis thoracis, the iliocostalis lumbarum, the longissimus capitis, cervicis and thoracis, the spinalis capitis, cervicis and thoracis. I don't think that they're going to ask you that. I don't think that they will ask you that. But if you look at the fibers, it'll make sense to you. It should make sense to you. So what we have are the SEG, the spinal erector group, also called the erector spinae muscles, also called the I-like sex group. Oh, one of these is missing here. Let me just put that in. SEG, erector spinae group, also called the ILS. Okay. Yeah. So, and if you look at the, I think I can get you a bigger drawing of that. I know I can. If you look at the muscles, you can see the different fiber collections. Oh, okay, look, extrinsic back muscles, intrinsic back muscles, superficial layer. So this should get us close. Yeah. I apologize, guys. I saw this thing earlier. Where is it? Where is it? Here's a good one. All right. So if you look at this, you have the spinalis, okay? Semispinalis thoracis, right? That's one of the deeper muscles. And then you have the spinalis thoracis. So different groups. Spinalis thoracis is part of the I-like sex muscles. And the semispinalis is part of the deeper layer. So you have the superficial layer, the I-like sex group, the spinal erector group, and then you have the deep layer, which is the semispinalis, the multifidi rotatories, and then very deep to that, you have the deepest layer, which I don't remember those, but we'll look at them in a minute, okay? So you have the semispinalis muscle, and then you have the spinalis muscle, right? So here's the muscle on right next to the spine, the most medial aspect. So it's ILS, I-like sex, right? So the next one should, so we got the S for the sex for the spinalis, and then next is the L, that's longissimus, right? So here it is, longissimus thoracis. It starts down here in the lumbar area, and they probably call this white part an aponeurosis, like a tendon, which means tendon. So you have the lumbar, sacral, and the ilium aponeurosis, and then those fibers extend up into the thoracic region. They're attaching to the ribs, the costa, right? And they have vertebral attachments in the upper thoracic. Looks like maybe thoracic vertebrae like 4, 3, 2, 1, something like that, or maybe 5 through 2, somewhere like that. And then remember the longissimus, they're named longissimus because they are the longest of those three group of the iliocostalis, the longissimus, and the spinalis. The longissimus are the longest. For the I-like sex, the like is the longest. So longissimus goes all the way from the sacrum all the way up to the skull. Well, where's the fibers of the skull? The answer is it's a different muscle belly, and they split it up here into left and right. So the left one is the longissimus thoracis. It goes up to the thoracic, and then over here is the longissimus cervicis, which goes from the thoracic up to the cervical spine, And then I think there's a final one, longissimus capitis, which goes from the upper thoracic up to the skull, capo, from the ribs up to the skull, capitis, right? So you have the one that goes to the capitis, the one that goes to the cervicis below that, and then the one that goes to the thoracis below that, the longissimus muscle. So again, spinalis, most medial to the spine, that's the sex. Longissimus, that's the like for the thoracic, and then the cervical, and then the capitis, and then the eye for eye like sex. The eye is the iliocostalis. So ilium, and then costa for cartilage. From the ilium to the not cartilage, I'm sorry, ribs. From the ilium to the ribs, iliocostalis. So it's attaching to the ribs there, and then it goes up and attaches to the cervical area, cervical spine as well. So iliocostalis cervicis for the cervical area, iliocostalis thoracis for the thoracic area, and then down here, iliocostalis lumborum for the ones that attach to the lumbar area. Iliocostalis on the outside, longissimus more medially, and then spinalis, the most medial aspect. That's the superficial layer of the back muscles. Don't forget the splenius muscles at the top, splenius capitis, splenius cervicis, splenius capitis, splenius cervicis, splenius capitis. Don't forget those. And then below are the erector spinae muscles, the spinal erector group, the iliac sex muscles. That's the iliocostalis, the longissimus, and the spinalis. All right, now the deep layer include the semispinalis, which we saw a minute ago on the right side of the spine, the multifidus, and the rotatories. And this is the last of the back muscles we will discuss, other than the quadratus lumborum. So the muscles on the deepest layer, which I don't know, we won't be discussing them. I'll show you them, but we won't discuss them. So the semispinalis muscles, again, the semispinalis has a capitis, a cervicis, and a thoracis. So capitis, it attaches to the skull. Cervicis, it attaches to the cervical spine. And then thoracis, it attaches to the thoracic area. If we go back to your lecture notes, they're broken up kind of nicely here. So you have the iliocostalis group, and then the longissimus group, and then the spinalis group. And if we could zoom in a little bit more. No, this is as far as we can go. Okay. So spinalis group, perhaps you can discern that there is capitis attachments here, and then cervical section, and then there's like T1 or T2. There's a thinning of the fibers. There's not many spinalis fibers there, and then in the thoracic area, there's a lot of fibers. And that's the thickest, actually, and the easiest to discern. So I would call this the capitis, because it attaches to the skull. And okay, those are the not the spinalis muscles. That's the rotatories, and these are also not spinalis. This is the multifidi. This is the spinalis cervicis, spinalis capitis, spinalis cervicis, spinalis thoracis. And then we move on to the multifidi and the rotatories. You can tell the rotatories from the multifidi because the multifidi are longer, the rotatories are shorter. You just have to get to know them like that, in my opinion. So what's interesting about the rotatories and the multifidi is that they attach at the vertebrae, at one vertebrae, and they attach to the side of the vertebrae below it. Or you could say they attach to the side the spinous process, what is this called? Somebody help me out with the name of the lateral aspect of the vertebrae. What's this called? You have the spinous process in the middle, and then you have the, nobody knows? Okay. Processes of the vertebrae. It's called the transverse process. So hard for me to remember transverse instead of lateral. So it's a process. So transverse process, right? And then spinous process. So the multifidi and the rotatories, they attach to the transverse process of one vertebrae, and then they attach on or very close to the spinous process. So in other words, almost in the middle of the vertebrae above it, or two vertebrae above it. The rotatories attach one vertebrae above to the vertebrae below. The multifidi attach one vertebrae above to two vertebrae below. So the multifidi are longer, sometimes three vertebrae below, it looks like. The multifidi are longer and the rotatories are shorter. So the function of most of the muscles of the back is extension if you contract them bilaterally. You guys really got to like put your thinking caps on here and also do a little movement. So most of the muscles, if you contract them bilaterally, stop share, will extend the spine, right? Extension is this way. So the capitis muscles would do this, the cervicis muscles would do this, the thoracic muscles would do this, right? So thoracic for thoracic spine, and cervical for cervical spine, and then capitis for the cervical spine and the head, right? And then that's if you contract them bilaterally. Contract any of those bilaterally, they all extend the spine. If you contract them just on one side, they will side flex the spine. They will side flex the spine, and some of them will rotate. I think most of them will rotate actually, but the difference between them, as far as I can tell, is that the deeper ones, they provide stability. And the more shallow ones, the superficial ones, provide more movement. So if you have one of my favorite exercises, which is a suitcase carry, if you have a weight in one hand, the natural tendency is for there to be side flexion or lateral flexion of the spine, because one hand is unweighted and one hand is weighted. That means that the muscles on the opposite side, the unweighted side, muscles on this side, the rotatories and multifidi, they have to contract and stay contracted and really work in order to keep your spine, centered, right? Keep your spine straight. So it is not simply a matter of, if we're talking about this left side of the body, it's not simply a matter of working these muscles by closing them toward the left, right? Or by twisting toward the left, or clockwise. This is the left side, twisting the left. This is twisting the left. This is twisting the right. Right? It's not just a matter of left lateral flexion or twisting left. It's also a matter of keeping the spine stable. The semispinalis group, the spinalis group, the thoracic, the iliocostalis, and the longissimus, they will do more turning than the multifidi and the rotatories. Yes, so more stability, more one side, when there's one-sided weight, more stability for the deep layer, that's the semispinalis, the multifidus, and the rotatories, and more range of motion for the superficial group. So I just tell you that so you can differentiate between them. I don't know that they're going to ask you a question in that way, but let's move on to the deepest layer, and I'm just going to show you these, and then we'll have just a few minutes left over, and in that few minutes, I would like to try to do some questions, some test prep questions. What's this in the chat? Okay, I see. I get rid of this, get rid of that. Deepest layer. The deepest layer include the interspinalis cervicis, interspinalis thoracis, interspinalis lumborum. Sounds like the interspinalis muscles. Okay, And then the intervarsare coli would be in the neck, I believe. Yeah, so those are in the neck. And then intervarsare lumborum. So here's the intervarsare coli. Wow, those things look complicated. And then the intervarsare lumborum. Which one of these? I guess there's two sets. Intervarsare lumborum for sure are on the side. Yeah. And then interspinalis muscles. So they're here, very, very fine muscles between the spine of the vertebrate, or the posterior spinous process, between the spinous processes of the spine. Okay. So that's it for the interspinalis and the interversari. If they ask you about, we're going back to the deep layer, okay? If they ask you about rotation, so of the semispinalis multifidus and rotatories, do they do contralateral or ipsilateral rotation? The answer is contralateral. So contralateral means that when you rotate the left side forward, it's the right side that's contracting. So I think I may have reversed that earlier, but yeah, if you're talking about the semispinalis multifidus and rotatories muscles, they do contralateral rotation of the spine and ipsilateral lateral flexion. So lateral flexion on the left would be the left semispinalis multifidus and rotatories, whereas left rotation with the left shoulder coming forward, left rotation would be the right side semispinalis multifidus and rotatories. I will double check that for you guys later, because that's confusing to me. No, it's not confusing. I'm just paranoid that I have something, that I have the direction wrong, and maybe I'm confusing left and right rotation. Okay, so now let's look at let's see if we can find a couple questions. Let's see, can we find in here? Let's find rotations, since we just left off the rotation. Okay, here's one for the external oblique. You guys try to ignore the green highlighting. Am I sharing my screen? Yes, I'm sharing my screen. Okay, so here's one. Which of the following movements of the vertebral column will lengthen the fibers of the external oblique on the right side of the body? Which of the following movements of the vertebral column will lengthen the fibers of the external oblique on the right side of the body? Is that rotation to the right, rotation to the left, lateral flexion to the right, bilateral flexion? And the answer is rotation to the right, which will lengthen the fibers of the external oblique on the right side of the body. Okay, so if we're talking about the right obliques, the obliques are on the front, the side, wrapping around to the back. So lengthening them would be right side rotation. Yeah, so the right side coming forward, rotation to the right. No, that'd be the other way. So left side coming forward, rotation to the right would be the left shoulder coming forward, and the head turning toward the right, head and chest turning toward the right, center line turning toward the right. That lengthens the fibers of the oblique. Right rotation. Let's see what other rotation questions we can find. Okay. Which movement will lengthen the fibers of the trapezius? It's not very nice. They don't tell you which section of the trapezius. Okay, but let's take a look. The extension of the neck, rotation of the head ipsilaterally. Which movement will lengthen the fibers of the trapezius? Rotation of the head ipsilaterally. So rotation to the right would lengthen. Rotation to the right would lengthen the right side. Rotation to the left would lengthen the left side. Depression of the scapula or flexion of the shoulder. Flexion of the shoulder contralaterally. So right side upper trap, flexion of the shoulder contralaterally. So you know it's not this one because it doesn't act on the shoulder that way. Extension of the neck, that's kind of tricky because we know that the lats do something with the neck, but I don't think it does much extension. But anyway, we're talking about lengthening rather than shortening. And if it does extension of the neck to whatever extent it does extension of the neck, it's shortening, not lengthening of the fibers. And then the question is rotation of the head ipsilaterally. Okay, so or depression of the scapula. Well, lengthen the fibers. Depression of the scapula is shortening. Extension of the neck is shortening. Flexion of the shoulder contralaterally. No, I would not say it does that at all. So it definitely, by process of elimination, is rotation of the head ipsilaterally. This is a case where I'm learning, and it's also an opportunity for everybody to learn, right? So rotating toward the right lengthens the fibers of the upper trapezius. Lengthens the fibers of the upper trapezius. Some of these 3-part muscles can be a little tricky because one part can shorten while another part lengthens. But yeah, it's rotation of the head ipsilaterally. Let's see if we can find another. Serratus anterior and pectoralis minor. Okay, what action does serratus anterior? Remember, that's tip of the scapula wrapping around to the ribs, and then pectoralis minor, that's from the ribs. That's from the ribs then attaching to the coracoid process of the scapula. What action does serratus anterior and pectoralis minor perform on the scapula? So pec minor would do this to the scapula. It would protract, and also maybe a little elevation of the ribs. And then serratus anterior would also protract, and I think it would likewise elevate the ribs. So perform on the scapula, would that be protraction, retraction, elevation, or rotation? The answer is protraction. There's no retraction happening. There's no elevation of the scapula happening because the fibers attach at the scapula and they point downward toward the ribs. There's no rotation. Rotation is, I think, both elevation and protraction happening. But more importantly, rotation is not something we associate with the scapula, but more bones that are shaped like axles, like the femur and the humerus. Okay, let's do one more. Let's see if we can find like semispinalis. Nope. Okay, let's spinalis. No spinalis. This is on the FSMTB sample questions. So this is from the people who are administering the exam. Let's see. Can we find capitis? No capitis. How about cervicis? Oh, cervical area. Cervicis, no. How about thoracis? Thoracic, thoracis, no. Okay, what about erector? No question directly about the erectors. How about longissimus? No longissimus. What about iliocostalis? No ilioc. Okay, I gotta say, guys, I don't know if I'm relieved or what. Splenius. Which one is the splenius? No, there's no splenius sample here. How about another pectoralis? Okay, there's 3. Great. Okay, which of the following muscles forms the anterior border of the scapula? Interesting way to phrase it. Which of the following muscles forms the anterior border of the scapula? Is that the teres major, the pectoralis major, the latissimus dorsi, or the serratus anterior? The anterior border of the axilla. Okay, so I guess if you raise your arm and you're looking at the axilla is the armpit. If you look at it as like a cave or a hole, like a fossa, proper term, if you look at it as like a fossa, the front of it would be formed by the pectoralis major, and the back would be formed by the latissimus dorsi. Serratus anterior would be a little bit below that. It wouldn't actually form the fossa. Okay, last one. Let's see if we can find a question about the teres or involving the teres. Okay. Which of the following muscles forms the cap of the shoulder joint? The cap of the shoulder joint. That's the deltoid muscle, not the teres muscles, and also not the trapezius muscle. Okay, guys, we're over time. That's all the time that we have for today. We'll do some of this next time. I would like to move into the muscles of the adductors. We already reviewed some of the muscles of the leg, I think, and we'll do the muscles of the lower leg, abdomen, and the obliques. Stop, share. So have a great night, everybody, and let me know if you have any questions or suggestions or anything. It's a lot. You guys need to make sure that you review the video, do it in chunks, right? Do a little bit for 2-3 days at a time, do the same chunk a little 2-3 days at a time, and then move on, and then try to do it cumulatively. Don't try to do it all at once, right? Make sure that you're doing those 3 sections of the exam on the AMTA app. So that's the 4 sections. So that's the benefits and physiological effects of soft tissue manipulation, assessment, reassessment, and ethics, boundaries, and laws. And there's one more. That's called guidelines for professional practice. Make sure you're practicing those on your AMTA app on your phone. Remember, the AMTA app is free, so it's accessible to anyone who has a smartphone. I hope you all have a smartphone. I know not everybody does. Okay, guys, have a great week. Please come to the class this Saturday and Sunday. It's the last Saturday and Sunday class. Please come to the class, and we'll get some of those like last 4 sections of the AMTA of the FSMTV, and we'll also get some other stuff. Great work tonight. I'll see you guys on Monday of next week, hopefully Saturday and Sunday of this week, 11 a.m.
I have a question.
Eastern time. Yes.
I don't know if I'm the only one here that hasn't attempted to take the MBLEx yet, but do you know about how many questions are on there?
I don't know. I don't know how many questions total. Does anybody know?
It's 100.
100.
100.
100 total.
2
Thanks,
hours.
you guys.
And they're randomized.
You have
Yeah.
passed with a 75.
What's that?
What'd you say?
You passed with 75% or something like that.
You passed with 75. The score, they don't give you the numerical score though, right? They say low,
it's just a pass
borderline, or
yeah. Pass or
Correct.
fail.
yeah.
Or
Oh,
high.
okay.
Yeah, if you score low on a section, it means that you failed the section.
Yeah, they said a 630 is about a 70%.
Mhm.
Hmm.
Thank you so much.
You're welcome. I think you guys need 12 weeks. I think you need 12 weeks to prepare. So you get 5 weeks with me. I think you ought to prepare an additional 7 weeks after this.
I have a Milady book that has just questions, and it got me last time. It was not my only try that I did last time, and at last time I got high. So that book really
That's
helped
great.
me.
That's great. What's the name of that book?
Milady is just questions. So like I say in the group before, whoever want to practice with me, we can grab a subject and we just do the questions, question, answer, question, answer, question, answer.
Okay.
Okay, that's good.
I do think
If you-
that doing just questions is a great way for the last 4 sections. I don't think that it's all you need for anatomy and physiology, kinesiology, and then patho. I think for anatomy and physiology and kinesio especially, you need to go through everything and see it. And I think for all that stuff, plus the other 7 sections total, I think that you need 12 weeks total to do everything. Right. A lot of people take the test not once, not twice, but 3 times or more. I think that it's a better, and they make you wait like a certain period of time between taking the test, like 30 days at least, I think.
30
So
days.
if you take it, yeah, so if you take it 3 times, that's 12 weeks right there. You know what I mean? So you either spend 12 weeks trying to pass, or you spend 12 weeks studying and then see how you do. Maybe you still need to take it twice, but. So someone likes Physiopedia apps. I like the AMTA app. I use AMTA, Yugo Prep, FSMTB. I also had memberships to 2 other sites. I don't remember what their names are, but just to survey everything. But I don't think it pays to do like as many questions as possible. I really don't. All right, guys. Not for anatomy, physiology, kinesiology, and patho. I don't think it pays to do practice questions for those, right? Practice questions for the other ones, absolutely. But for those 3, I don't think it pays to do questions only for those. All right, guys, you have a great week. I hope to see you Saturday and Sunday. All right,
Yes,
see you
sir.
soon.
Thank y'all.
Bye-bye. You're welcome.